We are back here on Carolina Women, and Erin, I'm excited to introduce you to Dr. Sherwood Miler. It's great to see you. Father of 2 young children, I will say, owner of his own orthodontic practice.
2 locations.
We're so good. We actually listen to you.
We do.
Talk to us a little bit about your practice, your local. Let's talk a little bit about you for a minute.
Absolutely. Well, thank you, Debbie and Erin, for having me here today. This is very exciting.
And yes, he has a great smile.
Yes.
Sorry to interrupt.
After 2 rounds of orthodontics already, but
he's a walking billboard.
Yeah, exactly. Yes. So just a little story about myself. Grew up in the Lowcountry in a large family. Was a Navy dentist at Parris Island for 4 years. After my Navy commitment, I convinced my wife to move to Atlanta and attend orthodontic residency.
Okay.
3 years later, here I am, the new owner of Miler Orthodontics, which was previously Bluffton Orthodontics, right on Buckwalter, and Coastal Orthodontics in Beaufort. And so we did a rebranding and new name, new logo, same great staff, just a new doctor.
We were just laughing as we were talking before. I've got 10 grandchildren, you've got 5 children, and you're like, that's so great, and we do adults. And we're like,
well, I was like, can we do a consult?
Yeah, exactly. Yeah, exactly.
It's not too late, though, is it? When you are aging
right.
or middle of age, I guess
it's never too late.
Yeah.
You know, traditionally it used to be mostly kids, and maybe only one child in the family got the braces, and now it's all the children seem to get them, and many adults. A third of our patients these days are adults getting orthodontics.
Why adults? What are you looking for? Because I know I'm 71 years old.
Because our teeth move.
Well, and I'm so conscious of smiles in people as I get older, because I see a lot of older people who haven't really taken care of that.
Yes.
Well, both you guys have beautiful smiles. I'll say that many adults had braces or orthodontics when they were younger, and just like the rest of our bodies, our teeth continue to change and move. So occasionally we might need to get in and do a little touch-up work. And the clear aligners have been particularly popular with adults for obvious reasons, cosmetics and comfort.
But other than cosmetics and comfort, what do you look at? What's important to understand about orthodontics? Because I think there's a huge medical reason for it too.
Yeah, absolutely. That's a good point. A lot of times that gets a little bit overlooked because everyone just wants the beautiful smile, which is amazing for your mental health, your confidence, but it's more than just that. You know, it provides a stable foundation for your bite,
your jaw,
and your teeth and your jaws to last you throughout life. And make sure they have their proper attachment to hold the teeth in place.
From a diagnostic point of view, when a child or a young adult comes in, what are you looking for?
So there's a whole long checklist. I would say the younger population, 7 to 10 years old, we're looking for cross bites, impacted teeth, late development. Most kids in that age range don't need treatment until all the permanent teeth are in. However, we do recommend the first consult at age 7.
Okay, this is important information.
Very important.
Well, I think if you get ahead of it, sometimes you can prevent much more intricate work later.
I couldn't agree with you more. I mean, if we need to intervene early, it'll prevent and save extra time, expense, discomfort for the patients and families. But I would say bread and butter is certainly still our 12 to 14-year-old kind of middle school crowd, where most of their permanent teeth are in.
How has orthodontics changed over the years? Because I remember, I'm 71 years old. So
you remember the headgears and
yeah.
all those funny things?
It's not as cheerful and broad-minded. There were no cool, rubber bands in hot pink.
No.
There was, it was hard to make orthodontics cool back then.
Yeah.
Just like the rest of the world, technology has allowed us to really expedite treatment, make it much more low profile, cosmetic, comfortable, and kind of give us the option to either go in for a comprehensive kind of 18-month, 2-year treatment, or just a 6-month limited case. So you're not locking yourself into 5 years full braces and headgear anymore these days.
And you know what? We really appreciate you coming today. 5 minutes goes quickly. So if we did nothing else but tease you, we got to have you come back and talk, because I think this could really be a series of really incredible discussions about your teeth, because your smile's everything. Stay with us. More to come on Carolina Women.